Well, Anthea has a great presentation. I think gave me the opportunity for highlighting some aspect of the mechanism. The most important, I think, is very accessible mechanism for civil society, but also I think it's important to highlight that the mechanism involves much more than advocacy for civil society. It involves capacity development, thinking strategically on the situation of human rights in the country, and recommendations can reinforce our agendas and priorities at civil society. It helps us also to find gaps that sometimes are overlooked for UN mechanisms and for the governments, and collaborate with other actors in networks or coalitions, and obviously give us the possibility of awareness about state accountability, and also is an entry point for other UN systems and mechanisms because as I said, the UPR is really accessible, and others are not as accessible as the UPR. But my presentation will be on a specific element of the mechanism, which means I will introduce you to the amazing universe of the recommendations. And the presentation is actually, the name is all about recommendations, which actually is not all, because if for discuss all about recommendation, we would need at least 3 days of workshop. But I'll share as much as possible as in order to help you to think strategically about your engagement with the UPR. I think that the recommendations are the most important element of the mechanism, because we provide recommendation in our submissions. We want that this recommendation, the recommendation we made in our submission, that these recommendations are made by the reviewing states to Canada. We want that Canada implement those recommendations to improve the human rights situation in the country. And we would like to monitor and follow up the implementation of those recommendations. As Anthea says, the recommendations are suggestions made from the reviewing state to the state under review to improve the human rights situations in the country. They can be quite diverse in nature and cover many issues, and as I said, for me are the key element of the mechanism. They are made to the state under review by other states. They should be responded by the state under review. The response could be accept or noted. All of them should be accepted by the state under review. The state under review should implement the recommendations in the period of 4.5 years between one review and the other. And they also can be key element for advocacy. So I have a question. Are you all agree with these affirmations? Someone have any comment? You can write in the chat or say yes or no. It's an open question for all. I'll be more specific. I say that all recommendations should be accepted by the state under review. Anthea and Megan are saying no. Anyone else? I say a couple of recommendations, so we should. There are recommendations from conservative countries, for instance. They say, for instance, recommendation calling to the state to preserve and protect the natural institution of marriage as the conjugal union between a man and a woman based on free consent. Or, for instance, uphold and respect the right of human right person from the moment of conception to natural death. Those are recommendations made by the Holy See or other conservative country that sometimes are countries that accept those recommendations. And those are clearly recommendations against human rights and against sexual rights. So sometimes it's important to be clear that not all recommendations should be accepted by the state and review. Actually, Canada haven't received so far a recommendation of this nature from this state, because also this state knows which country could make this recommendation and which country would reject those recommendations. But it's important to consider that. Other thing is important is, I think we go to the next one, please. I think that the best thing to think strategically about recommendations for many reasons is making a classification in different, using a different criteria for this classification. I know everyone, we are usually want to classify, and sometimes classifications are not useless at the end of the day, but I hope this is not the case. The aiming of this classification is to take into account different aspects of recommendations and try to find the balance among all of them, which will help us to formulate a good recommendation. So as I say, there are many criteria for classifying recommendation. These are the most, I think, the most important. There are more. One of them is by issue. For instance, maternal mortality, international human rights instrument, women's rights, abortion. Those classifications are actually the classification made at the SRI database for the UPR. Other classification is by response of the state and the review, accepted, noted. Usually they are not supported or rejected. You say, well, unclear response. Sometimes the state, the formulation of the response by the state and the review for one recommendation is not clear. There's no possibility to say that we accept it or not. And then sometimes a few recommendations have no response by the state and the review. Other classification is by the action required in the formulation of the recommendation. Some recommendations are very vague, are not specific, or some are very general, that this sometimes is impossible to monitor the implementation or follow up. And other classification could be which institution of the state should implement the recommendation. Sometimes it's the legislative power, the Congress or the legislator, or the judiciary system, or the Ministry of Health, Ministry of Development, could be the institution that should implement the recommendation. And this is very important when we formulate the recommendation. We can think it could be specific or not. We need to name the issue or not. We need to name the institution of the state. For instance, saying the Ministry of Health should implement a program for maternal mortality, for reducing the maternal mortality. And this is, I think, is important. So I think for formulating a good recommendation, we need to balance every aspect and criteria of classification to do the best recommendation as possible. In my opinion, as I said, the perfect recommendation doesn't exist, does not exist. But I think we can think about all these criteria and classification to formulate the best recommendation as possible. Next, please. Next slides are examples of the different criteria of classification. The classification of the criteria, taking into account the issue, we can talk about women's rights, and recommendation, for example, is adopt a national action plan on the Security Council resolution on women, peace, and security. On maternal mortality, the issue, and an example of recommendations is to take effective steps to reduce the high maternal mortality rate. I can say I don't know if this recommendation is specific or vague. For instance, what do we mean? What the state means with effective steps, for instance. The other issue could be domestic violence, gender equality, abortions, and for instance the criteria, the issue of abortion is sometimes the recommendations are very clear, very specific. Repeal laws criminalizing abortion and eliminate all punitive measure. This is a clear recommendation, very specific, and call to the state to repeal law. Here, the institution of the state who should implement the recommendation is clearly the Congress, the legislative power, the senators, and the low and lower and upper chamber, and that actually what happened in Argentina 2 years ago. The next, please. Another issue for classifying recommendation, and this is a very important aspect because when we become a very conservative country that receive a recommendation of sexual rights, sometimes very specific issue, for instance, abortion or LGTB issue rights, the state would not support the recommendation. But that's why the classification by response of the state and the review is another important aspect to consider when we formulate a recommendation, thinking if the state will or will not support the recommendation received. The response by the state, they are sometimes they enjoy the support of the state. And in the outcome, the document, which is the outcome of the review, the first list of recommendations are those. They say the recommendation formulated during the interactive dialogue and listed below enjoy the government's support. And the other response could be they are noted. For instance, the recommendation below did not enjoy the support of the government, and thus they be noted. Another thing is important to, sorry. Okay, yes, Lana. And different recommendations, usually sometimes the state did not respond to the recommendation and they deferred their response until the next session of the council. The next, please. As I said, the other classification is general and or vague and very specific recommendation. For instance, there are here examples of recommendations that are very general, address the problem of domestic violence. What this recommendation means could be anything. And very specific recommendation, for instance, repeal laws criminalizing abortion and eliminate all punitive measures. They are very clear and specific recommendations. Those are examples. There's a lot of examples. You can use the database, UPR database to find the recommendations, which are vague or where we are specific or other criteria for classifying recommendations. The next one, please. And there are other classifications that for me, they are made by experts in the UPR. The other recommendation is how the recommendation is calling for instance, and they say that the way to know what is the recommendation is the verb that used for initiate the recommendation. For example, the verbs call on, seek, or share. The verb continue, maintain, preserve, or other verbs using. This is another classification. For me, it's not sometimes it's not as important as other criteria. Another thing that experts on the UPR says, for instance, the next one, please, Lona, is that the recommendation should be smart. This means that should be specific, measurable, achievable, relevant, and time-bound. Relevant, I don't know what's the criteria for say that our recommendation is relevant or not. I think if we are submitting information about gaps of the state, everything is relevant. So the recommendation will be relevant for that. Another, and also specific, I sometimes there are strategies from the civil society that they decided the recommendation should not be specific or as specific as it should be, because there is a risk that the state do not accept the recommendation. In many states happens, and they decide the recommendation specific in order to that general in order that the state under review accept the recommendation, or we will do the recommendation vague or general in order to accept the recommendation. Also, there are strategies by civil society that do very specific recommendation, knowing that the state will not accept the recommendation, and they use this negative from the state for advocacy, also for shame the government for not accepting the recommendation. I think that will be all about the criteria. Well, the last one is the formulating the perfect recommendation, your perfect recommendation. You have to mix all these aspects and find the balance, because in strategic terms of what is the recommendation that we want. And this is the proposal now for you. In 10 minutes, we will break, I think my proposal is to break out into groups and think on an issue or two, or a population or groups of people that the rights need to be met by the state, or a situation that need to be addressed by state actions, and think or dream the best recommendations that you want to Canada to receive, taking into account this aspect that being reviewing now. This means that strategically think if the recommendation should be specific or vague, with the risk that Canada supports or not the recommendation. If you will want to name the institution of the state that should implement the recommendation, for instance, the Ministry of Health should create a program for, or if you want to name the issue, for instance, in order to decrease maternal mortality, and you are naming the issue or not. If you want to combine one or more issues on one recommendations, and then we want in 10 minutes, if you want to write the perfect recommendation for you, you will share after the break the recommendations, and we will share and comment the recommendation. We want the opportunity to say why did you formulate the recommendation in the way you had. That's the proposal for now.